And so I want to take a look at the evidence at a glance, the most, particularly for the people in the most vulnerable years. So let's talk about pregnancy. Well, vegetarian, including vegan pregnancy outcomes such as birth weight and pregnancy duration are similar to non-vegetarian pregnancy outcomes. And the differences reported are the following. There's a lower risk of excessive weight gain in the vegetarians, and the rates of pregnancy complications are generally lower among vegetarians. The largest vegan study to date was done a long time ago. It was done on the farm in 1987 and included 775 vegan women. The vegan diets did not affect the birth weights of the children, but preeclampsia was 0.1% among the vegetarian women compared to 5 to 10% in the general population. And the authors of this study concluded that it is possible to sustain a normal pregnancy on a vegan diet, and that a vegan diet could alleviate most, if not all, signs and symptoms of preeclampsia. So what about infant and child outcomes? Well, we know for lacto-ovo vegetarians that there have been studies, multiple studies over decades that have proven that lacto-ovo vegetarians are safe and adequate. Lacto-ovo vegetarian diets are safe and adequate for infants and children. Well, what about vegan diets? Well, there are far fewer cohorts, and mostly we have dated studies. We have consistently positive results on children being fed well-planned vegan diets. We have also seen negative results on children fed very restrictive vegan diets, and especially when parents are using homemade formulas instead of breastfeeding. And there were a number of studies back in the 70s and 80s of very grossly malnourished children who were being fed a formula that contained about 17 calories per 100 mils compared to about 70 if they were having breast milk. So these children were essentially starving to death. So that's not a good plan. Every time we see a child who's malnourished because they're consuming a plant-based diet, it sets us back 20 or 30 years. It's really important that we get it right, and it's not that difficult either. So let's talk about the vegan studies. There are really two classic studies. One, they basically reported that well-designed vegan diets support normal growth and development. The first was by Saunders in 1988. This one was out of the UK, and they followed 39 vegan children into adulthood. And although they were slightly smaller and lighter than omnivores, they were very healthy. And then the bigger one was O'Connell in the United States. This is the farm study again. 404 vegan children. They had slightly slower growth between 1 and 3 years, and that was because they were being breastfed and not being fed formula. But there were no differences after the age of 5, and those children did very well. The take-home message here is well-planned plant-based diets are safe and adequate at every stage of the life cycle. But infancy and childhood are stages of life where adequate growth and development are really the #1 nutritional priorities. The diets for children must be designed to meet the unique needs of infants and children. They need to be a little higher in fat than they do for adults, for example. In the position paper, the Academy of Nutrition and Dietetics outlines the advantages of well-designed plant-based diets for children. And what we see in children being raised on plant-based diets is greater consumption of vegetables and fruits, fewer sweets and salty snacks, lower intake of fat, especially saturated fat, reduced risk of overweight and obesity, and the establishment of lifelong healthy eating habits. And so there are many advantages for children. So what about adults? Do adults eating mostly or entirely plant-based meet nutritional needs? Well, there have been multiple studies looking at this, but the two biggest are Epic Oxford in 2016 and the Adventist Health Study in 2013. And I just want to show you the results because they're actually really quite surprising for people. So in Epic Oxford, they examined over 30,000 individuals, and they were all health-conscious people, but with different dietary patterns. So some were meat eaters, some were vegetarian or vegan. And the meat eaters had the highest intakes of protein, vitamin B2, which is riboflavin, B12, D, zinc, and iodine. And the vegans had the highest intakes of fiber, vitamin C and E, folate, magnesium, iron, copper, and polyunsaturated fatty acids. What about suboptimal intakes? Well, the meat eaters, about 50% were low in vitamin E, and the meat eaters also had the highest calorie intakes, the highest intakes of total and saturated fat, and the lowest intakes of fiber, all of which, of course, are not good. Now, vegetarian and vegans tended to have low B12 levels. About 17% of lacto-ovo-vegetarians were low, and vegans, probably 85 to 90% were low in this study. And iodine, again, the vegans, over 90% were low in iodine. So that's something to consider. The conclusion of these researchers was that compliance with dietary goals was high, and the prevalence of inadequate nutrition was low among all the dietary groups. The vegan diets appeared most protective against cardiometabolic diseases, and the vegans, however, do need to use fortified foods or supplements to ensure sufficient B12 and iodine. So the Adventist Health Study, too, and this is where the surprise comes in. They examined over 70,000 health-conscious participants, again with different dietary patterns. The meat eaters had the highest intakes of protein, vitamin D, zinc, and sodium. There were no shortfalls among the meat eaters except for vitamin D. And although they had the highest intakes, it was still below the RDA for vitamin D. The vegans had the highest intakes of fiber, vitamin C, iron, potassium, and magnesium, and they had no nutritional shortfalls except for vitamin D. So that was kind of interesting. And here, just to give you an idea, the non-vegetarians had the highest intakes of vitamin D and zinc, but you can see that vitamin D recommended intakes are 15 micrograms per day. They were only at 6.1, so they were still quite low. They had the highest intakes of saturated fat, of total fat, of sodium, and these are things that are not so desirable. Lacto-ovo-vegetarians had the highest intakes of B6, B12, vitamin E, and calcium. So B12, isn't that interesting? They were even higher than the omnivores. And the vegans, you can see fiber and vitamin C and iron and potassium and magnesium were highest. And if you look, you can see the vitamin B12 in the vegans was 6.3 micrograms per day, which is well above the recommended, unlike the UK, where almost everybody was deficient. And you can say vitamin D was too low in both of those groups as well. And then we have a study that looked at nutrition composition of whole food plant-based diets compared to standard American diets. And they looked at something called the Healthy Eating Index, and it was 88 over 100 for whole food plant-based eaters. It was 58 over 100 for people eating the usual American diet. And compared to MyPlate, which is recommended intakes by the US government, people eating whole food plant-based had 180% more total vegetables, 238% more green leafies, 460% more legumes, 100% more fruit, 132% more whole grains, 200% more nuts and seeds, 74% less refined grains, and 146% more fiber. So and if you look at nutritional, there was another study, this one out of Belgium, looking at healthy eating index and the Mediterranean diet scores, comparing vegetarians, vegans, and semi-vegetarians, pesco-vegetarians, and omnivores. And the people that had the highest scores on both healthy eating indicators were vegans. And so that tells us something. And I didn't mention, but the differences between the UK and the Adventist Health Study. The Adventist Health Study, we saw problems with iodine and B12, whereas we didn't we didn't see problems with the Adventist Health Study, but we did with Epic Oxford. The reason for the differences are actually because of the use of fortified foods and supplements by the Adventists and not so much by UK, but we'll talk a little bit more about that later. So are there any health benefits? And the answer is absolutely. Vegetarians and vegans are at reduced risk of ischemic heart disease, type 2 diabetes, hypertension, certain types of cancer, and obesity. And if you look at the numbers, and we won't go through this in any detail, but the red bars are the omnivores, and these are health-conscious omnivores. So these are people that exercise the same amount, smoke the same amount, drink the same amount of alcohol as the vegetarians and vegans, and they're conscious about their diets as well. But look at this. If you look at the lacto-ovo-vegetarians in blue here, these numbers are the risk, the reduction that we see in various diseases. So when you see 0.45 for hypertension, it means that they have 55% less hypertension than the omnivores, okay? So these are risk ratios. You can see for vegans, it's even better. So for hypertension, 75% lower because it's 0.25. And you can see for cardiovascular disease and kidney disease, the vegans and vegetarians are combined, but more than 50% of a risk reduction for kidney disease and about 32% risk reduction for cardiovascular disease. And you can also see not quite as stellar results for cancer and mortality, but still significant. Mortality was 15% lower among vegans and about 9% lower among lacto-ovo vegetarians in the Adventist Health Study too.